I mean, think about it. You've got these amazing filters inside you working nonstop 24/7. But what happens when they just stop? Suddenly. The fallout can be pretty serious, and that's exactly what we're going to get into right now.
Okay, so here's our game plan. First, we'll cover what your kidneys actually do. Then, what is acute kidney injury? After that, we'll look at the warning signs, dig into the causes, and finish up with how you can protect your own kidneys. Let's do it.
All right, let's kick things off with the stars of the show, your kidneys. I mean, these things are absolute powerhouses, and what they do every single day is, well, it's pretty incredible.
So here's the best way to picture it. Your kidneys are basically your body's super advanced filtration system. Your blood goes in and they get to work, pulling out all the junk, all the waste products and extra fluid. That stuff becomes urine, and the clean filtered blood, it gets sent right back out to the rest of your body. It's this nonstop cycle that literally keeps you alive.
Okay, so now that we've got a handle on how amazing our kidneys are, let's talk about what happens when that whole system just grinds to a halt, suddenly. And that brings us right to the heart of the matter.
So what is acute kidney injury? Well, the most important word to remember here is acute, which means sudden. This isn't something that happens slowly over years. No, this is a fast, abrupt shutdown. And when that filtering stops, all those harmful waste products start building up in your blood, and they build up fast, which can throw your whole system into chaos.
And you know, this is a really important point to make. We need to be clear about the difference between acute and chronic. AKI, the acute kind, happens suddenly. It's actually most common in people who are already in the hospital for something else. But, and this is the good news, it's often reversible if it's treated. That's totally different from chronic kidney disease, which, as the name suggests, is a slow and steady decline over a long time.
Okay, so a big question is, how would you even know this is happening to you? What kind of warning signs should you be looking out for?
Well, the symptoms can really be all over the place. You might notice you're not peeing as much, or you could see swelling in your legs, ankles, or feet. Other signs are things like feeling super tired, getting confused, feeling nauseous. But here's something that's really, really important to know, straight from the Mayo Clinic. Sometimes there are no symptoms at all. It can be completely silent, and it only gets picked up by lab tests when someone's in the hospital for another reason.
And that really underscores just how serious this is. The Mayo Clinic puts it very plainly. If you have symptoms that look like acute kidney injury, this is not a wait-and-see kind of thing. You need to get medical help right away. No hesitation.
Okay, so we know what it is and what the signs are. But the big question is, why? What actually causes the kidneys to just shut down like that? Well, it turns out the causes usually fall into one of three main buckets.
Yeah, you can really think of it in three parts. Either there's a problem getting enough blood to the kidneys, there's direct damage inside the kidneys, or there's a blockage stopping urine from getting out. Let's break each one down.
So, first up, not enough blood getting to the kidneys. I mean, they're not going to work right if they don't get enough fuel, right? So what can cause this? Things like being severely dehydrated, losing a lot of blood or fluid, a heart attack, or even taking too much of certain over-the-counter pain meds like aspirin or ibuprofen. All of these can slow down that vital blood flow.
Okay, bucket number 2 is direct damage. This is when something is actually harming the kidney tissue itself. We're talking about things like toxins, think alcohol or heavy metals, or serious infections, and that includes COVID-19. It could also be from certain drugs, like some antibiotics, or even when your own immune system gets confused and attacks your kidneys, which is what happens in diseases like lupus.
And the third one, blockages. This is a plumbing problem. If the urine can't get out of your body, it backs up. And that backup puts a ton of pressure on the kidneys and causes damage. What causes the blockage? It could be kidney stones, an enlarged prostate in men, or even certain types of cancer. So you can see, AKI isn't just one thing. It's a consequence of lots of different problems. So after hearing about all of that, you're probably thinking, okay, what can I actually do about this? Well, the good news is there's quite a bit you can do to protect your kidneys. So let's talk about an action plan.
So, how do you reduce your risk? Number 1, if you have conditions like diabetes or high blood pressure, working with your doctor to keep them under control is absolutely crucial. They put a ton of strain on your kidneys. Number 2, be smart about over-the-counter pain meds. Read the labels and use them only as directed. And of course, the basics always matter. Living a healthy lifestyle with a good diet and not overdoing it with alcohol. It all gives your kidneys a fighting chance.
So we'll just leave you with this one thought.
Your kidneys are working for you 24/7 without you even thinking about it. So, the real question is, are you doing enough for them? Something to think about. Thanks for tuning in.